In order to continue with our instructions on development, today I would like to talk about development for babies between 5 and 6 months of age. A baby at 5 months of age should be able to hold his head steady. He will pull up to sit, not showing any lag on his head. If your child is presenting a lag on his head as you sit him up, it's very important for you to take this baby to the doctor for further follow-up in development. A child at 5 months should bring his hands to his mouth and he will start transferring objects from one hand to the other. A baby will push up on his elbows when the baby is lying down on his belly. If by 5 months of age your baby is not supporting on his elbows, it's a good indication that he needs to be checked by a pediatrician or a developmental specialist. At 6 months of age, a child should be able to sustain his sitting position, not completely independent, just with a little bit of support, but being able to sit up with better posture. And the child should be able, from sitting position, should be able to turn his head to both sides to scan his environment. The child will attempt to reach, bring objects to the center of his body, transfer objects from one hand to the other, and to take objects to his mouth. When the baby is lying down on his belly, the baby should be having the skill to push up on his hands so his chest is all the way off surfaces. If your child is not doing any of these motor skills, it's better to take your child to a pediatrician because it's an indicator of delay in development. Same thing with his ability to look at objects. By 6 months of age, a child should be consistently tracking from the center of his body to both sides any object that is interesting to him and should be reaching for that object at a different positions of this object in space. The child should be looking at you and start responding to your verbal communication and to your expressions. The child will be babbling, giggling, the child should be interacting with you. If your child doesn't seem to be very interested in his environment, please take him to the doctor. There are studies nowadays that are showing a greater correlation of a child who is going to have features that fall within the autism spectrum disorder if this child is not very interested in his environment at around 6 months of age. We will continue working with more detail as we progress in age and stages, and pretty soon I'm going to start giving you potential red flags to look for in case the child will present characteristics for autism spectrum disorders.